Good afternoon, everyone. Today, we will be presenting on quality control tests of pharmaceutical suspensions. I'm Aryan Dishan, and my partner is Fatima Akhtar. Suspensions are among the most commonly used liquid dosage forms in pharmacy. However, because the drug particles are dispersed rather than dissolved, maintaining their quality and stability becomes extremely important. That's why quality control testing is essential before suspension can be approved for patient use. In this presentation, we will discuss four most important quality control tests used for suspensions and explain why they are performed, how they are performed, and demonstrate both failing and passing examples of each test. Now, next slide, please. What is suspension? A suspension is a heterogeneous dosage form in which insoluble solid particles are dispersed in a liquid medium. Because these particles are not dissolved, they tend to settle during the storage. Therefore, quality control testing is necessary to ensure uniform drug distribution, maintain stability, prevent excessive sedimentation, and ensure patient safety and therapeutic effectiveness. Next slide, please. Now, how to quality control test suspensions. To evaluate the quality of a suspension, several tests are performed during development and manufacturing. In this presentation, we will focus on four major tests. First of all, which is sedimentation test, volume test, which evaluates settling behavior, redispersibility test, which determines how easily settled particles can be resuspended, viscosity test, which measures the flow properties, the particle size analysis, which evaluates particle size distribution. Now, for the next slide. The first test is the sedimentation volume test. The purpose of this test is to assess the physical stability of a suspension by measuring the extent of particle settling. The sedimentation volume is calculated using the formula F equals to Vu divided by V naught, where Vu is the ultimate sediment volume and V naught is the original suspension volume. The method we're going to use is the suspension is going to be placed on a granulated cylinder and allowed to settle. The sedimentation volume is then measured and the sedimentation volume is then calculated. In the failed example, we can see that the low value indicates poor stability and excessive settling, so the suspension fails. In this example that passed, we can see that the high value indicates good physical stability, so the suspension passes. For the next slide. Okay, so the second test is the redispersibility test. This test determines how easily settled particles can be resuspended after storage. Its significance is that a good suspension should redisperse easily without forming a hard cake. The suspension is allowed to settle, then shaken manually. The number of inversions required for complete redistribution is then recorded. So if 40 inversions are required and still sedimentation remains, then the suspension shows poor redispersibility and it fails. And if the complete redispersion occurs only after 8 inversions or so, then we can say it demonstrates good redispersibility and it passes. Now for the next slide. So the next quality control test is the viscosity test. The purpose of this test is to determine the resistance of a suspension flow. This is important because very low viscosity can cause rapid settling, while very high viscosity can make suspension difficult to pour. Viscosity is measured using a Brookfield viscometer and the result is compared with the specified range. If the acceptable range is 300 to 600 cp, for example, the measured viscosity is 800, then the value exceeds the specification and the suspension fails. If the measured viscosity is at around 450, suppose cp, it falls within the specified range and then the suspension passes. So I'll pass on the next tests to my partner Fatima. Thank you.
Assalamu alaikum. My name is Fatima Akhtar. Today I will talk about some important quality control tests of pharmaceutical suspensions. This test help us make sure that the suspension is safe, stable, and effective. First, let's talk about particle size analysis. Particle size is very important because it affects the settling rate, stability, and bioavailability of a suspension. We can measure particle size using a microscope or a particle size analyzer. After measuring, we compare the result with the required specification. If the particle size is within the limit, the product passes the test. If it above the limit, it fails. Now let's look at the summary of our findings. Next slide, please. We evaluated four important quality control tests. Sedimentation volume, which shows the settling behavior of particles. A higher value indicates better stability. Redispersibility, which checks how easily the suspension can be mixed again after settling. Easy redispersion means the product passes. Viscosity, which measures the flow properties of the suspensions. Value within the acceptable range are considered a pass. Particle size, which check the particle uniformity. Results within the specification also pass. Next slide, please. Overall, a suspension is considered acceptable only when it passes all this quality control tests. This test help ensure product stability, uniform drug distribution, patient's acceptance, and good performance during storage and use. Next slide, please. In conclusion, quality control testing is essential for pharmaceutical suspensions. Tests such as sedimentation volume, redispersibility, viscosity, and particle size analysis help us evaluate the quality and stability of the product. By meeting all the required standards, a suspension can provide safe, effective, and consistent treatment for patients. Thank you, everyone.